Blog Talk Radio.
Following ingredients include a look behind the scenes. Cook uncovered until hot. Add grooves to taste.
I would like, if I may, to take you on a strange journey.
Once upon a time, there was a little girl.
The accident was over a year ago. A second woman has been elected president. The 12th planet has been named in the solar system. The last wild polar bear has died. I slept through it all. I was here for my waking. He called it a beginning. He said it was good. I think he may have thought that anything I did was good.
Welcome to Transition Radio, live from Wilton Manors, Florida, with your host, Mark Angelo Cummings.
And your hostess, Jessica Lynn Cummings.
Show for trans folks by trans folks, here to let your voice be heard.
Well, hello and good evening. Welcome to Transition Radio. I hope everyone had an awesome holiday. We've been off for 2 weeks. And we've missed doing the show and being here on Tuesdays and Thursdays, but, hey, vacation and holidays are important to unwind.
Exactly, but we're back.
We're back, definitely. And tonight we have Dr. Vartan, I'm sure if I pronounced this correctly, Mardirossian. He grew up in Bulgaria, and he quotes, "I am Armenian in origin." He studied medicine and surgery in Italy. He did his residency in head and neck surgery first in Italy and then moved to Boston, Massachusetts, where he did residency again in head and neck surgery.
But before we bring them on, we want to thank our sponsor, breastformstore.com. They have everything you could possibly need for your cross-dressing or transgender needs. Visit their website and tell them Transition Radio sent you. Dr. Mardirossian, and I hope we're pronouncing this correctly, but we'll find out when we bring them on. Dr. Mardirossian did a fellowship in facial plastic and reconstructive surgery with Dr. Spiegel, who is one of the fathers of facial feminization surgery, which is also known as FFS. Completed this past July. He says, "I have been extensively trained in FFS for the past 6 years, working in close contact with my mentor."
Now he's established in Jupiter, Florida, where his plastic surgery practice is. His expertise includes facial and body work with particular emphasis on facial feminization surgery. They perform surgeries in their office and fully licensed operating room and as well as the local hospital with highly trained and reliable staff. And now, ladies and gentlemen, welcome to our show. Let me get this little on button here. Why isn't it working? There we go. Dr. How do you pronounce his last name? Tell us if we're pronouncing your last name correctly, Doctor.
Can you hear me? Can you hear me well?
Yes, we can hear you.
Perfect. Yeah, you pronounced my last name really well. It's Dr. Mardirossian, and people around here call me Dr. M. I think that's a little easier. So you can call me Dr. M. That's
Dr. That'll work. Dr. M sounds easy enough. I'm sure that it's been botched up enough. So thank you so much for being on the show. We look forward to this show tremendously. I know there are a lot of transgender women who will be very interested in listening to the show. And
I don't think FDMs are interested in FFS.
No, I don't want to feminize my face. Thank God.
Sure. I just hope that everybody's voice can reach me. I mean, I can hear you very well. I just hear some voices in the background. I'm hopeful I'll be able to hear well and answer the questions.
Yes. Can you hear us okay, or are you having problems hearing us?
I can hear you perfectly.
Okay, that's awesome. So, what created the interest, Doctor, in working with the population of transgender individuals?
Well, this is a very good and very insightful question. I thank you very much for that. It kind of goes back to who I am. The answer to this question goes back into my background. As you said earlier, I'm Armenian. However, I was born in Bulgaria. And throughout the years when I grew up, and throughout the years of my childhood, I would have often people tell me what should I feel in terms of identity, what my identity would be. They were saying, "Oh, you were born in Bulgaria, you're Bulgarian." And then, and that was a little bit annoying for me because I'm Armenian and that's my identity. And then after, when I was 16, I moved to Italy to study medicine, to study first in high school and then medicine. I was really blessed to be in Venice and then in Padua, which are beautiful cities in the heart of Italy. And then people, it was funny enough, people would tell me, well, you came from Bulgaria, you should be Bulgarian, you're not Armenian. So, everybody was kind of telling me what I should be feeling like and what my identity would be, and I was annoyed by that because I knew I'm Armenian inside of me. So, years later, and obviously I maintain my identity, and I always say that I'm Armenian, and I speak the language and I have the culture. And so, years later when I encountered the problems that transgender community runs into and transgender individuals have, I really found them to be similar to the way I was feeling back in the day when everybody was telling me you should be this, and I was feeling that I'm not that, but something else. So I think from a sentimental perspective, that's what created the interest in working with the transgender population. In addition, obviously, to the fact that I was trained in a very busy center, in a very busy place where we were taking care of a lot of transgender patients.
Right, and that's very true in a lot of aspects of the comparison that you made, because, like, in the trans community, people that are just cross-dressers and don't want to go all the way with all the changes, but they're happy being cross-dressers. They're still transgender, but people in the transgender community say, no, you're not, you're a cross-dresser, which, in a sense, that's not correct because they are transgender.
Right. Yeah, and it's important to feel aligned with your identity, whether it's the country that you were born with or whether it's the fact that you have gender and sex in misalignments. I couldn't even think of anomalies. So, and it's a great thing that you're doing, Doctor, because it's a lot harder for a male to change into a female because of the secondary characteristics kicking in. I myself feel fortunate because as a female to male, hormones have done a great thing for me. And I haven't had to have any surgery except the removal of my female organs, the whole gonads, ovaries, and things like that, and my breasts that were removed. But males to females have it a lot harder, so you're definitely doing a great justice.
Which actually brings me to my question for you, Doc. What are your feelings regarding trans individuals, and how do you explain to someone what exactly it is that you do?
Well, I should say, first of all, that I believe that transgender individuals are some of the bravest people I've met because it is really not easy to kind of divert the tracks of your life and kind of take your fate in your own hands and change the direction of your life. That is extremely difficult, and that takes a lot of bravery. So, the highest respect is what I feel. It's the transgender patients are some of the most intelligent and well-read people that I have encountered. They're all on top of things. A lot of them have achieved a lot in their careers, in their lives. They're intelligent persons that have studied extensively what they're going through. They're fully conscientious of what they're going through, and by the time they come to meet us, their decision is really mature. How do I explain to someone what is that I do? I just feel that in this instance, a doctor is more than a surgeon, but it has to be a good person to give good counsel and good advice. and also to understand the needs of the patient. In this case, I think actually that plastic surgery is needed. It's, usually we talk about plastic surgery, we feel about plastic surgery as something that could be done or could not be done. But in this case, I believe it is necessary for the well-being of the patient that comes to seek your help. So it is very important to meet the needs of the transgender population and to give them good advice about what is appropriate for them and how would they find their proper identity. That's exactly what you're doing as a surgeon.
And explain to our listeners what exactly is involved in facial feminization. I mean, it's a scary thing to go under the knife. We all know that. And, what's like the recovery time. And I know we've had a couple of questions, and as soon as you answer that, I'll ask you a little bit more regarding what it's entailed as far as price and things like that. So give us a scenario of what's involved.
Sure. So facial feminization, first of all, it doesn't have to be an extensive surgery all the time. A lot of individuals, as you mentioned before, have taken hormones as hormone replacement therapy, and 100% of our patients are followed by a sexologist or endocrinologist who manages that. So, patients who have started this therapy early on usually have to have minor changes from surgical perspective. What facial feminization surgery entails, however, is first we need to do a profound evaluation and advise the patient about what procedures would be best suited for them. Now, the procedures that we perform under the branch and the field of facial feminization surgery can be divided in two main categories, two main groups. So there are the procedures that enhance the attractiveness and feminine look of the person's face, and under those I can list the forehead contouring, the scalp advancement, the brow lift, the mandible contouring, the trach shave. Okay, I'm sure these are all procedures that are well known to a lot of our listeners. And then there are procedures that are under facial feminization surgery that are intended to bring more youthfulness to your face, and those are the facelift, the blepharoplasty, rhinoplasty, the use of fillers, or even Botox. And those are, the second category are procedures that are intended to bring youthfulness, and you use them in transgender patients, but we use them also in males or in female patients. So once the evaluation is performed correctly, you can give an advice to your patient on what is needed and what is the cocktail of procedures that they would benefit from.
Excellent. And I have a question. Now, you mentioned the trachea shave. How complicated of a procedure is that, and what are the risks involved?
Well, let's put it this way. To do it right is complicated, and to do it wrong is not complicated. The way this procedure is done in the safest of fashions is to, while the patient is sleeping, we keep a close eye on their vocal cords thanks to our video fiber optic system. And then after defining the area where the vocal cords insert onto the laryngeal cartilage, we remove the portion of laryngeal cartilage that is above the vocal cords in a way that is not going to affect the patient's breathing or the patient's voice. And therefore, we can remove the maximum amount of cartilage without affecting the functions of the larynx, which are obviously vital. In my experience, along with my mentor, we never had problems. But, in order to be on the safe side, we always perform this in a hospital setting. I would strongly recommend this to be performed by highly trained individuals in a monitored setting, and the patient spends a night in the hospital under observation.
Very good. And one last question about that. What is the price range usually for the trachea shave, from lowest to highest?
Well, the price range for all the procedures correlate with, the time that you have to spend, the level of responsibility that you assume, and the level of skills that you may imagine. The best person to talk to about prices, obviously, is my patient coordinator, but I can tell you that it is within the range of, $2,000 to $3,000. That's what usually it is about.
Okay, and that's just for the trachea shave, or is that for the full FFS?
That is for the tracheal shave.
Okay, gotcha. Excellent. Okay, and then now, my last question. I know I'm asking a lot of questions.
Oh, no problem. That's why I'm here. I love your questions.
Thank you. What is the recovery time usually, and what is a patient to expect from the entire FFS procedure and experience?
So there depends, obviously, what cocktail of procedures you're performing. Some patients, as I told you, may need just a tracheal shave, and those patients are just spend the night in the hospital, which turns out to be their most boring night because they really sit there and wait to be discharged the day after without any problems. But again, if you go for more procedures such as forehead contouring and scalp advancement, that procedure alone has approximately a month of recovery to go back on, the baseline activities. Now, that being said, after a week or two, once the stitches are out, the recovery is underway and it's completed almost 60 to 70%. However, to be on the safe side and conservative, I could say you need a month to recover from a forehead contouring. Now, the mandible contouring is that procedure that shapes the mandible in a soft fashion. That is a procedure that can have some significant swelling, and swelling can persist up to 6 months. However, because some bone is removed, the mandible, the patient tends to appreciate the change in shape in the mandible pretty early, even if there is swelling, just because we have removed some bone and the mandible itself has become smaller. But I would say the mandible contouring is the one procedure of all the procedures I listed that sort of requires more time for the swelling to go away.
And what sort of complications have you seen in the past?
So the complications are the reason why the possible complications are the reason why we go through such an extensive training, as you can imagine. There's the most important thing that you have to watch for is the facial nerve, and the facial nerve runs through the entire face and crosses all the layers of soft tissue that we work on. Therefore, you have to be very aware of where the anatomy is, and that is why you need extensive training. Other complications, and we never had this happen, but that's how our approaches are developed, so that we avoid the facial nerve and avoid problems with movement of the face. Now, another problem that can happen is a widened scar that could be easily revised. It's not a big problem. Other problems, related to the procedures, it could be swelling, which is sort of expected. Infection happens rarely because the head and neck area are very well vascularized, and therefore the continuous blood flow prevents most of the infections from happening. So these are sort of the major complications. We've done many forehead contourings and scalp advancement, and that reveals to be, in particular, a very, very safe procedure. As I mentioned, the tracheal shave, if not done correctly, if done in inadequate conditions, it could be a procedure in an expert hand that can affect the patient's voice or patient breathing. However, that's the reason why we tend to perform, we always perform it in a hospital setting.
Right. And do you ever do any type of vocal cord tightening or anything like that as well?
Studies have shown that vocal cord tightening is more risky than beneficial. Therefore, in my experience and with my level of training, I would prefer referring a patient to a speech and swallowing pathologist for that.
Right, and now the thing with the vocal cord situation, with doing the tightening, I've heard stories that it's not even permanent, that they extend and stretch out over a 3 or 4 year period anyway, if I'm not mistaken.
Exactly. So you're at square zero, and I've seen, it's a pretty involving procedure. You have to substantially split the voice box and pull the vocal cords. It is definitely something that can be done, but is it worth it? I prefer referring the patients to a speech and swallowing specialist, and I've seen patients with excellent results from speech and swallowing evaluation and training.
Excellent.
Are there any preliminary things that the patient should do before actually going into surgery procedures? Anything that you...
A lot of our patients undergo, psychological evaluation, as you can imagine. A lot of them are followed by an endocrinologist. One thing that comes to mind is that it is important for the patient to be on hormone replacement treatment before we proceed with a procedure like the forehead contouring, the scalp advancement, because due to the position of the incisions, we don't want male pattern baldness to intervene after our procedure is completed, and so that you would be able to see the scar. We want the patients to be on hormone replacement therapy already, so that we have kind of the guarantee that their hair is going to grow through the incisions. We perform our incisions in a particular way so that the hair grows through them. However, male pattern baldness, if not on hormone replacement treatment, could compromise this result. Another thing to say is that a lot of times, almost always, patients are off of hormone replacement treatment, and I'm talking about estradiol, I'm talking about spironolactone, for fear of thromboembolic events. So they are off of it for a couple of weeks before the procedure and off of it for another week or two after the procedure, until the time they start walking around and having a good venous blood circulation in the lower extremities.
That's great advice.
Yes.
So I know that Italy, I've never visited, but I know that it's an amazing, beautiful country. How is the trans population accepted there?
Well, it's a great question again. Thank you. Italy, I lived in Italy for 16 years. I've been away. I came to the United States 7 years ago. The interesting thing about Italy is the following. Italy is a very innovative country with a lot of creative people and very progressive. And in fact, Italy was the third country in the world to make transgender procedures legal. It was 1982 when they did that. However, the thing about Italy is that it always takes them, and I'm not sure if it's necessarily a bad thing, but it always takes them a long time to acquire new ideas and the progress to kind of accomplish itself. So while they accepted the legislation in 1982, till some kind of hesitance to accept the transgender population without any discrimination. I could say that from what I followed the news, the left-wing parties are very accepting of the rights of the transgender population. Unfortunately, the centrist and right-wing, which have carry obviously the heavy traditionalist view of life, have a little bit of trouble accepting a non-discriminatory sort of view on things, and I've been following the news. In general, the transgender population is well accepted, but I think there is a lot to do on legislative level.
Yeah, definitely. So the biggest question out of all this is, where can our listeners get a hold of you, and what message of encouragement do you have for those wanting to look in the mirror and see what they feel in their heart?
Let me first start with a message. I told you, the transgender patients, the patients that I take care of, the male to female transformation patients, are some of the bravest patients I've seen. Again, I like calling this procedure gender reaffirmation surgery as opposed to gender reassignment. I believe that these patients should should remain faithful to what they feel, to what their identity is, and not get swayed by what the society tells them to do and how the society tells them they should feel. They should listen to their own hearts and their own feelings. I want to tell them that they're not alone in this. We are here to help. We are not only surgeons. We are also people, and we also hear their voice and hear their concerns and are here to help. Surgery is just one of the ways to help in this instance, in this case. It's a long process, I know that, and it requires a lot of bravery and a lot of patience. Where to find us? We are located in Jupiter. It's I think on your website you will have the information about my practice. We are in the heart of Jupiter, Florida, within a comfortable commute from Miami, and from also a couple of hours from Orlando. We are an hour and a half drive from Miami. Our phone number is 561-624-0900. I also have a dedicated Facebook page with my name, Dr. Vartan Mardirossian, and my website is in the works. So, you can also contact us over the phone or through the Facebook page, or my email address, which is vartan74@gmail.com.
Thank you so much, Doctor. All the information is on your page on our website, so if the listeners want to get a hold of you, all they have to do is visit our website, go to your page, and it takes them directly to your Facebook page. I've also added some of the information on your bio on there so they could contact you. This has been an immensely educational interview. We thank you so much for taking part of this.
Thank you, Dr. M, for answering all my questions.
Thank you very much, and anytime I'm available to answer questions of yours or patients or listeners. Let me know how I can be helpful.
Okay, don't tell me that because I'll be calling you every other day.
We appreciate it.
I'm a great, I'm not a great, you can call the office, obviously, to schedule, anybody can call the office to schedule an evaluation. I'm a great email responder, so, as you probably have noticed. So any questions that you have or any concerns, I am available to answer our listeners.
Appreciate it so much, Doctor.
Thank you so much.
Keep up the good work. Thank you so much.
Thank you very much.
All right, so we thank the doctor for being with us tonight on the interview, and now we're going to go in the trans views. And this is from South China Morning Post, Hong Kong. Draft laws for transgender marriage too limited, said expert Sam Winter. Draft changes to the city marriage laws to recognize transgender people are too restrictive because they're limited to those who undergo sex change operation. A leading transgender expert says, if I could turn this page, there we go. The Winter cited the World Health Organization's definition of transgender person as someone who desires to live and be accepted as a member of the opposite sex, and was usually accompanied by a wish to have hormonal treatment and surgery to reflect their desired sex.
He said the words usually were used the debate because there were individuals who met the diagnostic requirements for a transsexual but who opted to live as the opposite sex without going under the knife. The draft legislation is not inclusive or comprehensive enough. Winter said, but we are cautiously optimistic that the government will set up an interdepartmental, those darn hyphens kill me every time, group, which could be the first step to look into broader transgender issues without going to the courts, he added.
All right, thank you so much for joining us. We have great news coming up. We have actually bought our RV, and we are going to be heading on our journey really soon, taking our show on the road, our music and all that great stuff. Great new things coming in this new year, and we're very excited, and we're going to bring you along with us every step of the way.
Well, hopefully nobody listens to the show after the recording part of it. This way they don't hear me sing that Give It on the road.
Yeah, they will, because the show is it's on.
Oh, well, okay.
Anyway, thank you so much, Doctor, for all the great information. I hope you guys check him out if you're planning to change your face to be what you feel it should be. These doctors are great, and they're there to help you guys. Thank you so much. Again, we look forward to Thursday's show. We have Calpurnia Adams. I can never pronounce the name, but she's a wonderful, wonderful advocate, actress, performer, singer, comedian, you name it. You guys know her. Her story was Soldier Girls.
A Soldier's Girl
movie, and it was very, very touching. I saw that movie years ago, and wow.
Oh, it was just Soldier's Girl.
Yeah, Soldier's Girl. And she's up Thursday at 8 p.m. Eastern Standard Time, so you guys got to definitely watch that show.
Don't miss that.
Yeah, don't miss it. Hopefully you guys had a wonderful holidays. I know we did. A lot of changes.
And it's going to be funny. How are we going to change our intro now? Because it says,
Will Manor,
live from Will Manor, Florida. Who knows where we're going to be?
So it's live from,
You'll be able to follow us on Foursquare and stuff like that, because we're going to be checking into a lot of places, so you'll be able to follow us and find out where we're going.
Exactly. We'll get to be able to interview people on location. It's going to be exciting. So
might even start a YouTube series.
There you go. So you guys definitely have to check this all out. Exciting, scary a little bit. Just forked out cash for our new rig and home and everything under the sun, but it's exciting. So we hope that you guys
find it. It's an RV.
It's an RV.
So does that mean we're going to be considered trailer trash?
No, because it's not a trailer. It's an RV. And it's not trash.
Let's not give a shit.
Exactly.
My friend.
Exactly. But it's going to be exciting either way. And I hope you guys definitely, stay tuned and support us and support our music. And I'm sure those of you who have been following us have seen the wonderful things that we've been doing.
We're going to bring you some awesome sites.
Yes. A lot of beautiful.
We're going to be introducing a lot of these RV parks to training power.
Yes, exactly, and making them trans-friendly for all of us. And maybe create a caravan of transgender individuals RV. Who knows what's going to happen?
That way I can see it now. Training Man Max.
Yeah, Well, thank you guys once again. Good night. And you know what? We love you, but remember to always love yourselves too. Good night.